Hi, everyone. Welcome back. We're going to get started. Good afternoon. My name is Dr. Brandon Ito. I'm the Director of Justice, Equity, Diversity, and Inclusion for the UCLA Tarjan Center. In addition to my work at the Tarjan Center, I'm an attending psychiatrist in the UCLA Child and Adult Neurodevelopmental Clinic. I also work as an inpatient hospitalist on the Child and Adolescent Inpatient Unit and Eating Disorders Unit. I'm a provider in the UCLA Gender Health Program. It is my great pleasure to introduce our next speaker, Dr. Blake Warner. A little bit about him. Dr. Blake Warner is the Chief Clinical Fellow at the UCLA Semel Institute of Neuroscience and Human Behavior in the Peers for Education and Enrichment of Relational Skills, or Peers Clinic. He's also a postdoctoral fellow at the UCLA Tarjan Center. He received his PhD with a dual specialization in clinical and disaster psychology from the University of South Dakota, where he was a two-time leadership education in neurodevelopmental and related disabilities LEN trainee. Dr. Warner's research and clinical interests center on disability-related policy and advocacy training, as well as programs focused on the intersections of gender, sexuality, and neurodiversity. Please join me in welcoming Dr. Blake Warner, who will be presenting on dating and sexuality on the autism spectrum. Dr. Warner.
Thank you so much, Dr. Ito. I'm going to go ahead and share my screen. I have a PowerPoint for us to go through here. All right. Thank you so much for having me, everyone. I'm very excited to talk about a topic that's very important to me, and I know a lot of you as well, which is sexuality and dating on the autism spectrum. As Dr. Ito said, my name is Dr. Blake Warner. I use he, him pronouns, and I'm the Chief Clinical Fellow at the UCLA Peers Clinic. I also run the UCLA Peers for Dating group, and I will talk a little bit more about that later on in my presentation. I wanted to first start, though, by talking about where I'm coming from. So my viewpoint, my positionality, I do not have an intellectual or developmental disability. So I know that my experiences are different from those of the people I study and the people who I provide services for. And I want to learn from people in the IDD community. My goal is really to conduct respectful research that includes everyone and focuses on the needs of the community that I serve. I also recognize that I do have a lot of privileges as a white man, and I really know that that brings a lot of limitations due to my background. So I just wanted to acknowledge that I'm coming from that position. I also just want to give a brief content warning. Of course, by the title of this talk, you may know that we'll be talking about sexuality and dating in this presentation. I will say I won't go into anything too extreme, so there shouldn't be too much content to warn about, but I did just want to acknowledge that we'll be talking about sexuality and dating here today. The purpose of this talk, so if you zone out and you really only hear two things, I want to really normalize or make it normal to talk about sexuality and dating as topics with autistic individuals, but at large. And then the other main takeaway that I want folks to come away with is the idea that sexuality and dating and relationships are really important parts of human experience across the board, disabled or otherwise. I will also say that throughout this talk, I'll use the word autistic, but you can replace that with disabled or whatever word you might use. The things we'll talk about are not always unique to autistic individuals. They're things that people of all walks of life face. Just an outline of the presentation itself. I'll first start off talking about some of the myths surrounding autism and disability and sexuality and dating. I know there's a lot of misinformation about autism happening right now, and so I really want to debunk some of those myths first. We'll talk about how we can discuss sexuality and identity, and then I really want to focus on some of the barriers and challenges that autistic and other individuals might face, as well as some of the supports that we can provide through dating and sexuality education. And then we'll talk about how we can promote healthy and safe relationships, and we'll end with a conclusion and some key points. And I'll again briefly talk about the Peers for Dating program. So first, starting with some of the myths around autism and sexuality, and I'm sure many of you have heard these things, and I want to really challenge some of the common things we might hear. One of them being that autistic people don't have sexual desires, right? That maybe people on the spectrum don't want to have sex. The fact that we know is that most autistic people do have some sexual desires. Now, I want to acknowledge that sexual desire, just like autism, is a spectrum. So not everyone is going to be interested in having sex or having a sexual relationship. And I also acknowledge that asexuality, or not feeling any sexual desire, is a valid identity. So approximately 1 to 4% of the population might identify as asexual, and that's valid, right? Some people don't want sex. But what we do know is that from the research, and more importantly, from the perspectives of autistic people, many of them do want sex or do want relationships. And the way that we can help with this, debunking this myth, is knowing that sex and relationship education can help with these things. We can teach about different body parts, the functions of bodies, sexual acts, and all of these different things, as well as talking about safe sex practices. So if autistic individuals do want to have sex, how can they do so in a safe way? Another myth that maybe you've heard is that autistic people shouldn't be parents. Um, and what the research and what the facts tell us is that there are many types of families. Now, I'm not going to say that every person, autistic or otherwise, wants children or has to have children if they don't want to. But if autistic people want to have children or might be interested in having children, they deserve more than a no, you can't, right? Many people deserve education and might need some support and able to be parents. But we know that a lot of families do include members with members with disabilities, including my own and probably many of your families. And so sex and relationship education, once again, can help with this too. We can talk about family planning, reproductive planning, how reproduction happens, right? If we don't have the education around that, it's going to be really hard to tell people they can or can't have children. And I think we're doing a big disservice overall in our community, in the autistic community, but at large in parenting education, right? We don't really teach people how to be parents. So if autistic people want to have kids or want to have a family, we should support them in getting some of that education so they can make that an informed decision. Another myth is that autistic people don't want relationships. And the facts, again, many autistic people do want relationships. Again, just like sexuality or autism itself, relationship desire is a spectrum too. Some people want partners, some people don't want partners, and both of those things are okay. But what we need to make sure we're doing is providing education so that if someone wants a relationship, they can learn how to do that in a safe way. So we can teach things like relationship and communication skills, which is a big part of the Peers for our dating program that I'll talk about later. But we also teach things like self-protection and advocacy. If we are going to have a romantic relationship or that's something we're interested in, how can we protect ourselves and make sure that we're safe, as well as advocate for our needs and make sure that when we're having this relationship, we're doing so in a way that's making good choices for us and our romantic partner. And then another myth that I'll touch on briefly is that autistic people can't be LGBTQ plus or aren't gay or bisexual or lesbian, transgender, or queer or questioning. And what the facts tell us is actually the opposite of that. So we know that people can understand their own identity if we provide the education on it. So sexual and gender identity can be understood. And actually what the research tells us is that these identities are actually higher in autistic populations. So more autistic people identify as LGBTQ+. And in sex and relationship education, we can help with this too, talking about what is gender, what is sexuality, how do I identify, and doing some identity exploration. So there's all these myths that are out there. But when we're providing this sex and relationship education, there's a few factors or things that we should consider. One of them being that this type of education should be systemic, meaning we should use systems, including friends, family, community. I like to think about it this way. If we're not providing relationship or sex education, people are still interested in learning about these things. And when we don't learn in a classroom or in a therapy setting, we are learning from the internet or we're learning from our friends. So people are still getting this education, but it might not be accurate education. And so that's why I argue that we should, yes, learn from our friends, have conversations with our family, and as a community, we need to be doing a better job of providing this type of education. This education also should be developmentally appropriate. It's not a one size fits all type of thing. There's people who are going to be more comfortable in a individual setting. There's going to be people who learn better in a group setting where they can really practice different skills. And I'm going to talk about sex and relationships much differently with a 5-year-old than I would with a 30-year-old, for instance. So we really have to meet people where they're at and meet the needs of the community. It should also be comprehensive, meaning we should include a lot of different topics. Unfortunately, there's this misconception that sex education or relationship education is just teaching people how to have sex. And certainly that can be a part of this education, but it includes so many more things like safety in relationships, health factors. So what are my body parts? How can I keep them clean? And when do I know when it might be time to see a doctor about, related to some of these more private parts, for instance. So there's a lot of different topics that should be included in sex and relationship education. One example, and I'm not good, unfortunately, in 20 minutes, I can't provide an entire sex education course. But one of the things that's important to talk about is um, sexuality and identity. And so people think of sexuality and identity in a lot of different ways, but some of the things we might include are the basics of anatomy and physiology. So what are our body parts and what do they do? Sex differences. So people have different body parts, and how can we learn about those different things? Where do babies come from? Probably a very important conversation to have. So talking about pregnancy and birth control, as well as things like safe sex practices. If sexuality is something that someone is interested in, how can they do so in a safe way? We also talk about sexually transmitted infections, which are very common, and how we can have conversations with potential romantic partners about STIs or sexually transmitted infections. And then I mentioned earlier, how can we learn about our identity? And I'll provide a quick example of that too. So in learning about identity, as I mentioned, autistic people are much more likely to identify as LGBTQ+. But in order for us to really know about those identities, we have to educate ourselves first. Whether we're family members, whether we're providers, we really need to know the terminology in order to teach the terminology. And so one resource that I absolutely adore is the Gender Unicorn, which really is just a quick way to learn about the differences between gender and sexuality and attraction, all with a unicorn, which is an even better way to learn. Lots of examples kind of like this, but in this picture, for example, it talks about our gender identity is how we view ourselves, our expression is how we express ourselves. Sex assigned at birth is, our genetics or our body parts. And then our physical and an emotional attraction, who we're physically or emotionally attracted to. So just a quick way to learn some terminology. Okay, the next part I want to briefly touch on here is some of the barriers that autistic people and others with IDD or other disabilities might experience and supports that we can provide. And many of these supports is what we focus on in the Peers for Dating program that I'll end the talk with. So first of all, one of the biggest barriers that autistic individuals face is limited chances to date. It's a hard world out there. It's hard to find people to date, romantic partners and romantic partners who share interest. And so the support that we provide, and one of the things that we really focus on in the Peers program or Peers for Dating is to teach people where to find romantic partners. They don't just magically appear, right? We have to put some work into it to find people we might be interested in. And of course, dating apps come to mind, online dating. And we know that not everyone is interested in online dating, but it is quickly becoming the #1 place where people are meeting their romantic partners. But we also know that other places that we might meet romantic partners are through mutual friends or social activities we might participate in. And so we really focus in our program in Peers for Dating on where we can find romantic partners if we're interested in dating. Another barrier is difficulty in interpreting those sort of unwritten dating rules that are out there. There's a lot of unspoken things that are happening, and we might not know about them. And so how we support in this area is by teaching both socially helpful and socially risky behaviors related to dating. And so some examples might be showing interest. How, if I'm interested in someone, how could I flirt with them? And I imagine many of your parents didn't teach you how to flirt, right? We just kind of are expected to know how to flirt. But we know that not everyone knows that. So we teach flirting skills in our program. We also teach very concrete steps on how we can ask someone out if we're interested. And I might miss out on a lot of dating opportunities if someone's interested in me and I don't know. So we can also focus on how to tell if someone's interested in us. And then another barrier that comes up is, unfortunately, autistic individuals and disabled individuals are at a higher risk of exploitation or being taken advantage of because of some of those differences in social communication. And so one of the things that we teach in our program is consent. How do I give consent? What is consent? How can I ask for consent? We also teach people how to set boundaries. If I'm not okay with something, how can I say no? There's a risk of misunderstandings as well. So if I am interested in someone, there's more socially helpful ways of showing those interests. So we teach qualities of healthy relationships as well as really social skills for dating. How do I interact with someone as I'm learning to date? When is it appropriate for me to move to the next step? How do we have conversations about what we are? So lots of different ways that we can help with that barrier. As we're promoting healthy relationships, one of the big areas, as I mentioned, is boundaries. So there's relationship boundaries. This is being able to let my partner know when I am uncomfortable with something instead of just tiptoeing around those facts. And being comfortable sharing thoughts and feelings with the partner. So if I do have thoughts or feelings, I might need to share those things and advocate for myself. We also know it's helpful, and in our program, we focus on moving on if I'm not interested. It's not fair to anyone if I lead someone on because I don't know how to say no to them. And one thing that we really focus on is that dating is a choice. I don't get to date everyone, and not everyone gets to date me, and that's okay. That's part of the dating game. We also talk about personal boundaries. So these are things, what am I okay doing with my body? And if someone asks me to do something with my body that I'm not okay with, how can I let them know that in a firm and respectful way? We also know that it's difficult sometimes to separate our feelings from a partner's feelings. And so learning how to do that is an important skill. And one thing that is very important in romantic relationships is being able to share things about ourselves and be vulnerable and authentic. And so we teach in our program how we can share our differences and diagnoses if that's something that's important to us, and how to do so in a strengths-based way. I think it's really important in the community to be able to draw on the strengths because there's so many wonderful strengths of autism that make us really great partners. So in Peers for Dating, we focus on those strengths and make them assets to a relationship. I'll kind of end here on talking about qualities of a healthy romantic relationship. This is a great starting point for us all to think about relationships we're in or thinking about and decide whether these qualities are happening for us. So one big one is sharing of common interests. These are the things we're going to be doing with our partner or talking about with our partner. So it's really important that we have some of those things in common. We also want someone probably who's kind and caring, offers support, commitment and loyalty, some honesty, trust, equality. We want relationships to be two-sided, right? No one's more important than someone else in a relationship. Communication skills are very important, being able to feel safe and secure and comfortable just being ourselves around our partner. Hopefully we want thoughtfulness, consideration, reliability in a partner. And then, as I mentioned, just being open and sharing of feelings when we have feelings and feeling close and connected with our partner. Most of us have shared values with our partner. You know, things like politics and religion are important to a lot of people. And so it's important in a relationship that we have some of those shared values, as well as empathy. When my partner feels sad, do I feel sad too? And how can I respond to that? Physical and sexual compatibility are important in relationships. And then when I'm uncomfortable with something, Does my partner respect my personal boundaries? Are we able to compromise when we have differences and resolve or get through disagreements? So these are all really important qualities of healthy romantic relationships. And we cover these a lot in our program in Peers for Dating, as well as these other skills that I talked about. So some key points before I end here is that everyone deserves sex and relationship education if they're interested. And, sexuality and dating are important topics for us to discuss. They shouldn't be left to the wayside. When we understand the barriers that are out there getting in the way, it helps us understand what we can do to support individuals. And ultimately, dating is a choice. We deserve the choice, but everyone doesn't get to date us, and we don't get to date everyone. And I'll end here on just announcing that we are now enrolling for our Peers for Dating online social skills classes. So these are neuro-affirming, evidence-based dating skills that we teach in our program. I'm leading the program, so if you want to come work with me, you can sign up. And kind of an interesting piece about this program is that we provide the education for dating skills to participants, but we also are providing coaching skills. So our dating participants will bring a family member, such as a parent or a sibling, or a peer if they want to bring a close friend to attend the class simultaneously. So at the same time, but we're going to teach them how to be a dating coach while we teach you the dating skills. And so if you're interested in participating, we are enrolling worldwide. This is an online program. You can contact us at peersclinic@ucla.edu or scan this QR code to learn about the program where we teach where to find romantic partners, online dating, how to ask someone on a date, healthy relationship boundaries and dating practices, consent and safe sex practices, as well as handling conflict and rejection. I'll go ahead and wrap it up there. But thank you so much for your time and attention.
Thank you, Dr. Warner. Clearly an important topic. We're getting some questions trickling in. We'll answer those in the Q&A section, so please keep putting your questions in the Q&A block. It's now my pleasure to introduce Mark Bazza. He hails from Chico, California, and has worked at the We Care a Lot Foundation since 2008, where he serves as an instructor. He teaches the Respect Yourself program, leading classes on healthy relationships and sexuality for fellow individuals with disabilities. Mark, it is a pleasure to have you with us today, and the floor is yours.
Thank you, Dr. Brandon. Some people say I am a man of few words. In conclusion, thank you very much. Only kidding. First off, I want to thank the numerous people at UCLA for allowing me to be a part of this forum. Also to the audience on Zoom. My name is Mark Bazza, and I'm from Chico, California. My supervisor, female co-instructor, and I form a team called Respect Yourself, which is part of the We Care a Lot Foundation in Chico and Redding, California. My co-instructor and I teach 2 co-ed classes on healthy relationships and sexuality to people like ourselves who receive services from our local regional center. These classes were created to help reduce the abuse regarding people with developmental disabilities. I also want to add that I'm a graduate of the UCLA Leadership Academy for Emerging Disability Rights Leaders. Also, in my presentation today, I'm going to talk briefly about our 2 classes, Me and You, followed by Respect Yourself. Then I'm going to talk briefly about a major obstacle we're trying to overcome, followed by a success story, and wrap things up with a closing statement. Okay. The first class that we offer is called Me and You. It meets once a week for 4 weeks. It is very important to have good self-esteem. We ask people that we serve what they like about themselves, how learning something new could help raise their self-esteem. For them to surround themselves with the people who support them. I feel there are too many people that are overly apologetic, and I encourage them while they're walking out in the community to walk with a sense of purpose and awareness. We suggest that they focus in on the things they feel good about. We offer examples of famous people who have or had a disability. Albert Einstein had what is now known as Asperger's. We talk about the different types of relationships in our lives. The most important one being is the one we have with ourselves. Okay. And we have a handout that talks about what I like, what I want, and what I don't like. Have interactive role plays where they decide if something is personal, working, public, or a stranger relationship. For example, someone asks a stranger questions about the public bus system. We get a lot of feedback where people say, never talk to strangers. We add, as long as you're not talking about things too personal or too personal or private, it's usually okay. Play a game where they decide if something is always private, such as personal thoughts, banking information, sometimes private, dressing room at a department store, or public, the public bus. We cover talking, body, and working boundaries. For example, for talking, if someone was to ask you about your finances, quickly say, I'm not comfortable talking about it. If they ask it again, can we please change the subject? If it's posed a third time, walk away or say no while walking away. Now, what makes up a good relationship? This could be with a friend or a sweetheart. You feeling good around that person most of the time. You feel respected, able to make choices. You have good communication, can agree to disagree. On the flip side, what makes a bad relationship? In our PowerPoint, we have a picture of a heart that slowly disintegrates every time someone says to you things like, boy, are you stupid. How did you ever learn to be funny? You never learned how to be funny. How to advocate for yourself. Listen to your inner voice when something doesn't feel right. We cover mental, emotional, financial, and sexual abuse. Our second class is called Respect Yourself. This meets once a week for 7 weeks. Again, my co-instructor and I teach to a co-ed audience. One major roadblock we are continuing to face is trying to sell Respect Yourself to parents, guardians, and administrators that run day programs because of their influence. Regarding parents, I think they are put off by their adult offspring learning about sex and wanting to have an intimate relationship, despite it being totally natural and normal to think and be curious about sex. One approach we take in trying to sell Respect Yourself to prospective students is the different types of cancers that we cover: breast, prostate, testicular. For women, breast, mammograms, and pap smears. What to expect when you go in for an exam: tools and procedures. Early detection is key. Also, I might say, you might not be interested in having an intimate relationship, but it'd be educational to learn the in-depth process in which babies come into the world. Regarding dating, what qualities are you looking for in a partner? Where to find that special someone? What activities do you like to do? Are you willing to try new activities? If you do meet someone and you set up a date, make sure it's in a public setting the first few times. We talk about internet safety. We have a picture of a poodle sitting on a plush chair saying, "I told her I was a pit bull." Have a dating boundaries handout on when, for instance, would you feel comfortable kissing your partner? After the first few dates, 6 months, or after a year. A romantic must-haves handout, which covers the opposites. You want someone who's active on the go, who likes to relax and take it easy, or not important? So why is it important for people with developmental disabilities to learn about sex education? What's the alternative? Increased chances of getting into trouble with the law, a higher risk of getting an STI or unwanted pregnancy. They learn that their whole body is pregnant, not just their reproductive parts. We go over the STI, we go over sexual rights and responsibilities, the 4 Ps: permission, privacy, person 18 years of age or older, protection. Go over the STI brochure. They quickly realize that STIs are no joke. There is this one guy who is very friendly and popular, who had difficulty finding appropriate people to date. However, after taking our classes and specifically learning about the 4 Ps, which brought a sense of clarity to him, he was well on his way to having better relationships. I talk about some so-called fun facts of the human body, promote this YouTube video called Life Before a Birth, which follows a real pregnant woman. What's interesting is at times it has the embryo and fetus narrating the journey, pointing out all the new discoveries. Regarding the topic of sex, we tell the people that we serve that it's perfectly okay to laugh and show other emotions. I also want to say that the people that do scheduling for day programs don't promote or encourage the importance of these classes that we teach. In closing, I just want to say that I think it's very important for people with developmental disabilities to learn about such topics as privacy and boundaries, what makes a good and bad relationship, body health, and sex education. Thanks again for having me.
Thank you. Thank you, Dr. Warner, for the powerful talk. And thank you, Mark, for sharing your passion. I definitely would love to take this class with you teaching it. It sounds like a lot of fun. Um, we have some audience questions. I'd like to kick off the Q&A. First question for the both of you would be, can either of you comment on how sex education in general can be made more accessible and affirming for neurodivergent learners?
Yeah, sure. I could kick us off here. Again, I think it's a lot about meeting folks where they're at, and recognizing that dating and sexuality aren't always one size fits all sort of approaches. In Peers for Dating, for instance, which I definitely forgot to mention, is housed under the UCLA Tarjan Center. So it's within house here. Was developed here at UCLA by our director, Dr. Elizabeth Laugesen. So forgot to mention those things, but very importantly, I think we're taking a group approach, and a group approach isn't going to be fitting for everyone. Not everyone is going to appreciate being in a room or a Zoom setting with 12 other individuals, and so some folks might prefer an individual approach. And then, practically, pacing is also important. Some people might clip along at a pretty quick pace, and others may need more individualized support, go at a slower pace, and learn kind of different things too, because sex education and relationship education is so varied across different schools, different states. And so people are coming in with vastly different levels of education. So we have to kind of meet people where they're at.
Appreciate that. Mark, maybe this is a question I can ask towards you. You talked a lot about the roadblocks and all of the important safety pieces in your course.
Hmm.
How do we also help people experience the joy and connection in relationships? How do we let others know that other than safety and roadblocks, there's also a lot of joy and connection that can be found?
Yeah, to for them, what activities they like to do, and try try new activities, and um, so yeah, so we're just trying to have people, find their place, and just to be responsible, and um, to be aware of they what what's safe and everything in their relationships. Um, so we would, like, sometimes people would want to, like, get married after they're, you know, a few months, and that's not realistic, or really gonna last long, right? So we would, like, encourage them, or like make suggestions, but just, yeah.
Yeah, I agree with you, Mark. I think that's so important that we're balancing those things, right? Of
Mhm.
course, we want people to have relationships and be informed and do so in a safe sort of way. So we can weave safety into just about any topic that we talk about within dating and sexuality.
Mhm.
I'm going to start with a few of the questions in the Q&A. I know, Dr. Warner, you mentioned developmentally appropriate, and I think this overlaps with Roxana's question, which is, what's the ideal age to start a conversation with her daughter, who is 10 years old?
Yeah, so I think that plenty appropriate to start at or before age 10. With kids, for instance, young children. I think one of the important things that we can start introducing is the correct terminology for body parts. Of course, it can be really uncomfortable to talk with a toddler about their penis or their vagina, but it's really important that we're starting at a young age to have these conversations. And it's helpful to know the important terminology, but it also helps to open up the conversations later in life too. So the earlier we start building in comfort, so that when our children or whoever we're working with does start to become interested in sexuality or dating or romantically interested, they're comfortable bringing up those conversations.
I think that's great. And like Mark was saying, the consent and the boundaries is important. I know I have a 3.5-year-old and we're reading yes, no, information about body consent. And so all of these things can start very early. Um, the next question is, so there's a couple questions asking about adults in middle age or resources for adults. Are there any that either of you particularly like or recommend in general?
Yes, I think there's a lot of great educational resources online. I think again, I'll put in a plug for Peers for Dating. We don't have a strict age requirement for that. But there's also really great resources through other programs online too. So a lot of autism specific sites have dating or relationship, sex education sorts of resources as well.
This is another question that came up. So Nicole is asking about any resources for adult individuals having identity or sexuality conversations with their families. So she works with college students who live with their families who are LGBTQ identified and are hesitant to bring it up with their families. Maybe I can start with Mark. Is this something that comes up in your classes? Do people talk about different sexual orientations?
Uh, um, no, not much, but we just say the different relationships in our lives and, gay, straight, whatever those two people in particular feel comfortable with, it's okay.
What I love about your program is that no matter who you are interested in or what relationship you're interested in, all of the things you talk about apply to every relationship.
Exactly. Yeah.
Yeah, that's true for our program as well. I'm glad that that's hopefully a fairly universal aspect of a lot of programs. But we really emphasize that different relationships are okay in the peers program. And I'm so glad that Dr. Lageson has kind of built that affirming stance into the program. But another resource that I think for this particular question could be helpful is there's a website called the Trevor Project. And they actually have a pretty nice coming out guide that talks about some of the nuances of who can I talk to? When is it appropriate to come out to someone? And so I would maybe start with some of those resources as well on the Trevor Project.
That's a great resource for a lot of individuals. Let me see. There's a question that I thought was interesting from Dr. Aldana. She also says, "Yay, Blake, and great job, Mark." What are some of the things, Mark, that people say to you after taking your class?
Well, I don't know if it would be appropriate, but it was a revelation when, a certain body part would transform. So,
And I
for a
think
one, yeah.
some of the stories you shared too, Mark, were really powerful of that they maybe didn't have a lot of knowledge before the class and afterwards felt more ready to date and experience those things in the community.
Yes, yes. And I didn't mention this woman that had a poor history of being abused. She repeatedly started taking our classes, and then she realized that relationships could be good, and so she ended up like getting married and stuff like that and being pretty content.
I would say, like Dr. Warner presented, there is increased risk of victimization, which makes both of your programs not just about relationships and dating, but it's really about safety and people getting being able to live safe lives. So that's really important. There's a question from Karina. I think this involves one of the things that you mentioned, Dr. Warner. What is the difference between socially appropriate and risky behaviors? How are we defining those?
Yeah, so that's great. That's the neuroaffirming stance of peers. That's the language we use in peers. And the reason that we use socially appropriate and or socially helpful and socially risky as our language is because a lot of the time there's not a clear yes or no. Not everything is going to always work out, and most things don't never work out either. So we kind of avoid those kind of binary yes and no. But we know that there's a lot of things when we're dating that could be socially risky. So for instance, if I walk up to someone and I say, "Hey, do you want to go on a date?" People might think that's kind of creepy, and I might it might not work out for me if my goal is to date someone. So instead we show those examples, we talk about why that could be socially risky, talk about some perspective taking, why might that not work out, and then we talk through and show some examples of socially helpful versions of that. So if I'm going to date someone, it's probably a good idea that we know each other a little bit first. So we might talk and trade some information, find some common interests. And then I might even do a little decision making. Is this person a potentially good partner? Is it a good choice for me? And then I could maybe go through some steps, get to know them, and then ask them out if it feels like it's a good choice. But if we're using kind of a socially risky approach to some of those things, it's unlikely to work out. So that's kind of the stance we're taking with socially risky and socially helpful.
And I wasn't sure, Mark, is that something that you talk about in your program as well?
About what was, can you repeat the question, please, doctor?
Sure. The question is about socially appropriate or socially risky behaviors. Are those types of things that come up in your program?
Um, Not really. We initiate it, but we always, um, like with the STI brochure, has what protection to wear, you know, and assortment of stuff for women, and what could happen if you don't. So, safe sex is really the way to go.
So kind of a lot about choices too, right?
Mhm.
And
Yeah.
when you're doing your work, Mark, good
Yep.
choices, kind of
Yeah.
risky choices. Great.
Exactly.
There's another question about are friendship skills as well as dating skills incorporated into your programs? So if someone builds a relationship with someone that might be a good friendship, but not a romantic relationship, is that discussed or talked
We,
about?
yes, if we put it like, if you don't have romantic feelings for that person, so the distinction is there.
Yeah. And we certainly talk about that a lot in Peers. As some of you might know, Peers was originally developed as a social skills program for making and keeping friends. And absolutely, whoever asked that question, you're pretty spot on that in order to be in a successful romantic relationship, most of the time, if not all the time, it's really important that we are getting to know someone and going through the process of making friends too. And so our program does start off with kind of basic conversational and other skills related to friendships. And then those things kind of shift into romantic relationships because that's really the natural trajectory or natural way that a relationship often goes is that we get to know someone, we become decent friends, hopefully, with them, and then move on to romantic interest as well.
Great. Yes, Mark?
Um, I would like to say that, like in dating boundaries, we put it like, if you don't feel comfortable with doing something, you don't have to do it. If somebody wants, you have that right to speak up whatever way you can. And also, for putting on a certain type of protection, if you can't do it, if you lack like fine motor skills, maybe you could ask your partner to help you.
Mark, these skills are good for everybody. Everybody in relationships. I'm so glad you're talking about them. There are a few questions that are sort of related to access. Maybe Dr. Warner, about eligibility criteria, Medi-Cal recipients, virtual classes, health insurance coverage.
I'm assuming related to peers, hopefully. I don't
Yes,
know the insurance world
I
too much.
believe so.
Okay, wonderful. Yeah, so at this time we're recruiting educational classes, and so they're available worldwide virtually. And what that means is we're not able to take insurance because of that, and so they are private pay or self pay at this time. They are available worldwide, as I mentioned. We're recruiting, and so. Eligibility criteria, you do not have to be autistic to be in the program. So anyone who's interested in learning dating skills and skills related to making and keeping romantic relationships could be eligible over the age of 18. Of course, this is for adults only. And so those are kind of part of the biggest criteria in that sense. Were there any more kind of specific questions that I could answer? Or is
These are
that a good overview?
these are virtual classes as well.
Yes, they are virtual at this time.
Okay. And then there was another question about how do you monitor if the program is helpful?
Yeah, that's a great question. So I'm going to nerd out, but very quickly. So Dr. Lageson just completed our second randomized control trial of the Peers for Dating research study. So we have done a lot of research on this program to make sure that it is effective. We just completed research on the program virtual versus in person and a control group. Actually, I think we sent out our last round of measures today or yesterday, so still collecting a little bit of data there. But that is how we're kind of monitoring and making sure that the program is effective for those we're hoping to serve.
And can regional center clients get the costs of classes covered?
Oh,
For
sorry, go ahead, Mark.
yeah, they provide it. The service coordinator refers a client to the regionals, to us, and to a day program or whatever. So yeah.
Yeah, and I think, Mark, your program is specifically for the Northern Regional Center, right?
Um, yes, yes, but we could venture out and do, virtual too. We did it, during COVID.
Sure. Yeah, and then peers in general, we sometimes are able to work with the self-determination program. So if you're with the self-determination program and interested in peers, that could be a potential possibility.
Thank you for those. Before we wrap up, maybe in the last couple of minutes, I'd really love to hear from both of you why you do this work. What is the most meaningful part of teaching this specifically?
Well, for me, I like it because, there's a lot of feedback with the people that I serve that it's, something new that they learned about, so. And I was just thinking, like, sometimes, because we ask, because it's just how everybody's feeling. Like, raise your hands if you want a friend, if friends are important to you, or like having a significant other, you know. Um, but I wonder if, and maybe one of you or Dr. Blake can answer this. like if I post it to the person in private or publicly during your class, that if they want it, and and if they are like parents or people that look after them object to having a, a relationship like that, what steps can I take, or we take to help them, so they're not demoralized? Like, is there, if some like parents or guardians don't think their adult offspring is ready, how to approach that, like, and I use the word intentionally, adult offspring, because if somebody looks at people with disabilities as perpetual children. But anyway.
Yeah, thanks for sharing that, Mark. I think I'll springboard off that. And I think what I liked what you said is that so many people have said they want this. And I think that's where I'm coming in from my perspective, is that so many individuals want romantic relationships as part of a meaningful life. And so I think that's really the crux of it for me, is that how can we provide a meaningful life for people? And there's such a need for these services and for this education. And like Mark is saying, there's kind of a cultural shift happening where people are thinking that they can have successful romantic relationships. And there's programs like Love on the Spectrum that show that autistic people can be very successful in relationships. And so I think it's an important service that we're providing.
Well, once again, thank you both for an amazing session. I can't say enough about how important this topic is. We're going to be taking another 15-minute break. When the program returns, our next and final speaker will be Dr. Maya Ayub, who will be presenting on communication supports, evidence-based practices, and considerations in access. A brief reminder to everyone that each presentation is being recorded, and we'll have the recording and presentation slides available on the UCLA Tarjan Center website in a few weeks. A plain language podcast episode with Dr. Warner and Tarjan Center disability rights advocate Holly Oliver is now available on Spotify and on our website. The link we will post in the chat. We will see everybody back at 3:15.